sound or colors or whatever we use in the next future, in the next 20, 30 years. But the idea to treat all that functions that belong together, I think that's the most important idea we have learned by the Asiatic acupuncture. We didn't know before. He said, this is the sinuses, this is the bronchus, but what is the large intestine, the long distance, no connection with them. But that there are connections and that there are functional connections and that they are very real for us in our therapy, that we have learned acupuncture and we have to use it. Okay. I think it was the last one or one more? It was the last one. I think it's too much for you if we take now more information. Better now we have little exercises, is it?
Okay.
For I will not stress you too much, and little movement for us is good now after.
You want to take a short break? Is that it, or?
No, we want to do exercises.
We can do it exercises now.
All right.
You will get now some. I have here this name, such small. What is the name? Finger cuts. So you can take for you or for your neighbor that you can have a palpation and can train it how to do it, and then if one or the other is.
What do? Put it on my finger while I go near your mouth, and you put it on your finger.
Yes, so we do palpation here.
Vaughn's patient is going to be coming down in a little bit. Be here at Dr. Cromer House. And so we can do that, and I think we can all learn from it. And we'll get the cameras up here so we can all retain our seats.
Better you keep this, isn't it?
Yeah, I think so.
Okay.
Let me, while we're waiting to get started, let me have a raise of hand of all the people that would like to be potential members of an organization that does this kind of stuff.
Another one?
Another one? Okay. Well, I mean, all right, let me see how many people don't want to be in it. Okay.
Five.
That's another one. Thank you. We'll be contacting you. We have, first of all, we need your credit card numbers. Yeah. And we do electronic transfer in this organization. This is modern telecommunications. We're not fooling around. Okay? We got our modems and we got the whole works. We have an uplink too, okay? So we have it all. And that's where we're going to go. All right? But maybe not this week.
Well, if you can't do it this week, then we might as well forget it.
And Bruce, we are having a cocktail party tonight. I just wanted you to know in case you wanted to bring your mother.
I have a brother overseas. Can I send him something?
He has some questions that he wanted to ask, but he said ask until the cocktail party.
That waitress is waiting.
Take on the whole group. The meeting is always going to be here. You know, as lovely as this place is, it's not at the end of the
Did you read the yellow sheet I handed out, or did you throw it away already?
You filled it up.
Here, it tells the subject if you have any, if you don't, whatever you want. It has a speaker, And then it has a location, so you can write it 1, 2, and 3. And we'll analyze those and determine where we're going next.
I thought you wanted to get dressed.
One thing that is exciting is that the Germans wished us well in our endeavor here, and they, through Dr. Gleditsch, suggested maybe a joint meeting sometime in the future. And I think that would really be great. We could have it in the Caribbean or meet them halfway. Something like that. Marbella, any...
So we do our preparation again. I have many fingers here. Did you some exercises by your own or by your neighbor? If you did, or if you didn't, please use it. I put it here.
Purposes.
Give it to the other colleague, please.
You will do that. I'll stay here with that. There will be too many. What?
Can we take it off the tripod?
I think it's more steady when you have it
Now
on
again,
tripod.
we first had to ask for his history, but now we only will have the perfect, is it? Again, we begin the drawing line.
Too small?
Okay. Okay. You see? Okay. You have to put on a candle here. That's okay. Everything okay? Right. I'm only
Gary, give me your room key.
Okay. Inside the mouse. First inspection again. Okay. Okay. No amalgam. Here's a ascending mandible, you feel it? No, okay.
Yeah.
Here it hurts, you see? Again, the areas painful and pressure are the typical areas: upper jaw, wisdom teeth, retromolar region. We can, for control, palpate here, large intestines, not too much. Right side? No?
Okay.
Yes? So, no complaints. Okay. You see, if there are only these 2 points sensitive, no complaints, no large intestine points here at the hand, okay, no treatment. The cervical spine is moving in a right way, everything okay. Only for get the feeling how it is. If another like to get the feeling of the patient, come here. Yeah. But do it yourself too. Take your neighbors and have this palpating done. During the break, I palpated one of your colleagues here, and it was painful here in this area in a higher degree. And in this case, I took another check at this area backside, as if you would put in Sagita.
Shoot an arrow.
Shoot an arrow here, it would come out here again. And this...
The cross arrow.
The cross area, yes. The cross arrow check. And this area was again painful. Think of it, it's very painful on the front side, it can be in the same level on back side. And then you can be treated on both sides. I usually begin in these cases on dorsal pain area. Okay. No. Yeah. Ja, tender. Very good. Don't like it here.
Nein, das ist Tender, das heißt hart.
What does that mean in tenderness there? If
There's a little difference here. You feel it as a finger and you feel it, you see the reaction. I used to look at the patient's face, for these are typical reactions. You can see, but I didn't stress it too much. Again? You don't like it? Here's the rest, is it?
Dr. Gleditsch's famous soft fingers.
soft concrete.
It's not quite good, but it's not so much. Okay. Okay? See, this is fine. I have not yet seen an amalgam filling here in your group. Fine.
Doch, habe welche dran.
Yes, left. Oh. Yes, here they are.
They were supposed to have been taken out the Wednesday before I came down, but I didn't have time.
We'll do it right now.
I looked at the lower jaw, but there are 3 fillings in the upper jaw right side. Doesn't matter. Next week. It hurts. Takes the patient. Better than my... Yes. Yes. It doesn't like it. It's the ascending mandibular. You see? Ascending mandibular. No, you may... Here it is. It goes nearly up to the TMJ. All this area is very sensitive. Right side more than left side, is it? Now again. The upper jaw, thankfully. No. Here again. 7th, 8th, retromolar area. Very painful. Again. Now we can check the hands. Large intestine 4, large intestine 10, he doesn't like it. 11, not so much. Most 10 and 4.
Right.
So maybe more the right side.
Yes.
You see?
Also das gibt es bei links und der Arm rechts.
Just a little tender.
Little tender, but
right there.
tender at this sternum area, tender at the yaw angle, tender in the ascending mandible area. So we have a check outside, open a little your mouth, little, only such as it's now. I palpate the temporomandibular joint outside, little tender, right side more here, left side, again, right side here, feel it. And now I have, you can differentiate. This palpation meets the joint, and here, 2-3 fingers caudally, deeper, there's only muscle points, which hurts more.
Right.
This one or this one?
That one.
The lower one?
Right there.
Right there. So it's tender, especially in the muscle.
Masseter?
Masseter, yes. Inside, here, and outside. It can be the tension. If much stress is it. You feel the stress here and you feel the stress here too. Hard work, maybe. Whatever it is.
Close bite?
But these points here at the arm and at the upper jaw may give us the idea of a dysbiosis again. That you may change a little nutrition, maybe, I don't know.
No coffee. Dr. Gleditsch, would you explain to the group what you explained to us in the break about the TMJ point,
Yeah.
master point for those that do
Thanks,
TMJ work?
thanks. The TMJ can be palpated best in this level, you know. If I had the other palpation in the lower region, more corresponding to the masseter muscle, if it's much more painful in this area, so I suggest the problem is primarily in the muscles as trigger or myofascial pain as we call. So I would suggest first to treat the trigger points, the acupuncture points, however you will call it or do it. And if you doesn't succeed, then you can treat the joint, split, or whatever you do. But first in this case I suggest think of the point, think of the tension in the muscle. For I've seen that we had patients splits in many months or years and nobody had palpated this tension in their muscles. Nobody had looked at them, nobody had treated them. After 2-3 treatments they were well. Many cases had to be combined, that you have to do treatment of the trigger point, of the treating of the myofascial pain, and also treating the TMJ, maybe by split or by other methods you can do. But again, begin with this. What is the simplest? What is done in a very simple way. If it helps, okay. If it doesn't help, you have to go next step. My method here has been this morning to step by step. To begin with the simplest one. If it doesn't work, next one. If it doesn't work, next one. And the third or fourth step is my dear colleagues that they have to do. Like the acupuncture or whatever it is. But to begin, that I can do first, and then next step is whatever it's due to do.
Do you ever do trigger points into the jaw joint itself, into the joint?
Yes. Yes.
You talk a little bit about what medications that you do use.
Yes. The problem is what you could have for injections here. For I have some of our remedies. This is a heel again. Heel, you know. You can get it here.
We can't get that here yet.
Not yet, but I'm sure that you will get it soon. There are ampoules of special solutions of hail.
You can get the ointment.
This here, for example, is Traumel, and in Traumel you find arnica, you know arnica, hypericum is in it, some more calendula, you know calendula, and I have to look at it, chamomile, symphytum for the bone, as you know, and what's more, echinacea. Echinacea. So you see, it's a very good combination. Echinacea, it increases our defense system. Arnica for all our wounds and all our injuries. And Hypericum, more for the nerves, the autonomic nerve system. And Symphytum for problems with the bones. There's a very good combination too that can be used. And I use this hormel in, yes, the potency is between D2 and D3, and one is the, no, it's D2-DC combination, yes. You can send it around and have a look at it. This is one of these hail ampoules. I like to use these ampoules, for example, for treatment if there had been a trouble, a wound after extraction, after wisdom stays, because of the arnica, because of the symphytum, and so I also use for sinusitis treatment, and I give the injections in the upper jaw area, and it's the solution. Please have a look once more. In former times we had an information that the solution where it is done, it was a special one again, but maybe it has changed it. Good. Another one is this lymphatic remedy von Heal. Our name in German is Lymphomyosot, lymphatic remedy. There's Veronica, Teucrium, Pinus sylvestris, Gentiana, you know, Sarsaparilla, Scrophulus, Calcium phosphoricum, and some more. I will give it. Pass it on. Good. But to give some more answer on your questions. Homeopathy in our country, as well as in the States, is very hard to learn, and the others it's very abgelehnt, very it's not at all accepted by the governments and by the universities. And now one of our professors at Munich, not a medical professor but a pharmaceutic professor, is a decan of the pharmacy faculty in Munich. He had lots of researches during the last 3 years with the echinacea. And he found out, and that's so interesting to tell it to you, that echinacea in animal researches works to stimulate our defense system more if you don't use the normal solution, but if you take the potency of 5, 4, a little 6, but if you go higher up again, it's not the same effect. That it really increases if you go up to the potency of 4, 5, 6, and then it again stops or goes or decreases again. So it's first time that a professor of the university in animal researches and animal experience could show us that plant remedies, like this echinacea, plant remedies have a very good effect on our defense system, defense mechanism, and that it works better in a homeopathic potency than in normal dilution. I think that's the beginning for us to go on this homeopathy and to say not only we that are considered as outsiders can use it, but in the university a very good research had been done, and it encouraged us to say, look at these findings, they are really true for us, and they can go on during the next years. They have some other plants now, and I hope we can have some more arguments against all our colleagues and friends who don't believe in homeopathy. That's what I'd like to stress about homeopathy. Gary?
Yes. Could you tell me again where you would inject that
Remember, whatever you inject at this point we have talked about, it's your choice. You can use either the anesthetics, these anesthetics that are, as this one here, the capules. You can use saline solution. You can use cyanocoine. You can use sesmeaverine, that is carbo. Okay? So, it's your choice. But we didn't talk about this morning that we have to think of allergy. Also, if it's very seldom, most allergy is to be found with procaine, and therefore this implitol was developed not only because of the allergy, because of the toxic factor of procaine. Procaine has a little toxic impact in it, and they added caffeine to it, and this caffeine counteracts the toxic effect of procaine, and so it was used in many years as implitol, and it was developed by Dr. Hunig of Germany, who was the pioneer of neurotherapy 50 years ago now. But I, in my practice, and many of my friends, if we use implitol, we like to mix it up with some more saline solution, so that we get a lower percentage. I have done in my practice many years that I mixed it 50-50. 50 saline solution, 50 implitol, and so I added 2 or 3 ampoules of this choline. You remember I demonstrated this morning. This is widening effect on the lymphatics, choline. The counteractor of the vasoconstrictors, choline. Acetylcholine. You will get it here in your country, I'm sure. Not the same name, not the same fabrication, but you will get it. But not necessarily you have to add it, but only to give you an idea. And if there's a patient who has allergy against procaine, you can test it in the conjunctiva with some drops you put in, or you can give him a very little superficial twaddle at a place where you can control it if it gives an allergic reaction. But as you are dentists and you know your patients and they have been treated by you in many other cases before and they got the extraction, whatever it is, and you have used other anesthetics with them so you know them, I think you would not give therapeutical injections for patients that you haven't met before, for other treatments. So this problem is not a new one for you, isn't it? Good.
Have you ever used adrenocortical extract? Cortical extract?
No, I didn't use it. And for the question we had before, there's another one from Hale again, Hale. This is Engestol. This is one of most used again, and bestseller of Hale. I hope you will get it soon here in the States. It's especially for virus infections. For we really have problems, you know, antibiotics they don't help. And if we have patients now with virus infections or with special influenza, we can use it with Vincitoxicum D6, Vincitoxicum D30, Pflanzenasche, what is it?
Plant ash.
Plant ash. From Vincitoxicum, and it is sulfur in D10. Nice. And I use it very often, and it helps me a lot. Maybe that you can get it also in tablets or drops. You can put it in acupuncture points. And again, if I have patients, for example, suffering from acute flu, influenza, whatever it is, I give these remedies. For example, I mix up Angestol here with the Traumel. You have seen Traumel with arnica and Symphyton in it. Yes, I mix it up here in one syringe, and I either give half milliliter here in the upper jaw area, and maybe right side, left side on the large intestine, 10, 11 or whatever it is. And so I've given treatment. I don't talk about what I did. The other doctors, patient come and visit them, and yes, Gleditsch has given me some injections. Oh yes, he had done with vitamins, with antibiotics. I don't say what I use. Better for us, we don't talk so much about homeopathy just now. But as long as we give injections, I have in my praxis the feeling that patients are sure that we did something which can be accepted everywhere. And if there would be another colleague accuse you, in the case you wouldn't have give your patient antibiotics and he believed it might have been necessary, you can say, yes, I gave my patient injections. It was very similar to antibiotics. They don't know what it is, isn't it? Yes. But I don't know what kind of ampoules you get here. You get your vitamins. You can give injections with vitamins.
Yeah, vitamins.
And have you homeopathic ampoules to use?
None.
None, not yet.
And they know about it, but we don't have any yet. Manufacturers know about it.
But I have to say, in my practice, I for 1 year did not use any anesthetic, only to prove my work, if it's possible without anesthetic, if I would get the same results. And I have to say, yes, I proved the point, and the proof is there are differences. But you get the same results if you use only natrium saline. And you get the results if you use only homeopathics. So it's your choice what you do. I have learned that the points are as important as what you do. Inject within the points. And this stabbing needle we talked about, and you have seen when I have done here with some of your colleagues, this stabbing needle suddenly touch a point which gives a very strong reaction in the patient, that he says, yes here, or now, or whatever, or reaction in his face. You have seen it. So I have called this reaction the very point reaction. That if you touch a special point, that might be the trigger point, that triggers really the best result. So it's best reaction also in acupuncture. You can do acupuncture as Chinese doctors do. You can say, yes, here's a point, and you can put in your needle. It works. But you can, if you are not sure if it's the best point, you can have this stabbing needle on the area, and if the patient has a very strong reaction in his face, in his gestic, or verbally, so you know you have hit the point, you have struck the point. And so you will see the advantage of this method. Another only reminds me, many of our patients don't accept what we do. In spite they come in our practice and they ask for help. I have seen with Dr. Diamond. He had a test with us when he came to Munich, and he had 2 or 3 of our colleagues in the group come here. He said, hold up your arm, I will give you a question. What is your trouble? Oh, I have so much trouble in my cervical spine, many, many years. Fine. Would you like to get health? No. Another doctor, come here, what's your trouble? I have a trouble with my hip. How many years? 20 years. Come here, do you like to get health? No again. 3 doctors he asked, and 3 said no. And I say it's very common with our patients too. The subconscious mind of ourselves knows that so many other doctors had done their best. They came to clinic, they came to X-ray, they came to so many methods, they got injections. So many things had been done. So we don't believe that we can be cured. Our inner subconsciousness gives no. This is no. Here we say yes. I go to this very nice doctor. He will help me. But our subconscious says no. And so if you come to a point where the patient is, where the patient, I trick the patient that he has to say yes or here. So if the subconscious would agree, yes, now is the chance. Takes the chance now. And therefore I've seen this touching such a very point helps us also to overcome our subconscious resistance against all invasive methods of medicine. For all our patients, and many of our patients, they are in their subconscious very negative. It's very normal now with all our population, and you know why it is. We have seen it in our own body. We asked, in this case I talked about this Dr. Diamond, we asked this doctor what was their problem in a deeper view. And the orthopedic doctor said, yes, my cervical spine trouble I've had in 10 years now. And I have been x-rayed each year. And I went to my very famous professor at the university clinic. He is a friend of mine. And he tried many treatments and he didn't succeed. So I know there's no chance for me. And later on he got acupuncture treatment, he was cured. Can be. But he was already shut. You know what I mean? Closed. He was closed with the subconscious. He didn't believe that there was a chance for treatment. After he had got so fine treatment by his professors, so many x-rays, he knew his x-ray findings and so. So it's a very good help by the stabbing needle that you can
play a trick.
Yes, you play a trick with the patient that he would say yes or no, and this is the very moment, the very point to say now we try anew.
Would you talk a little bit about when your TMJ, about how your spiritual center is shut down, your psychic center?
You think of psychic centers like chakras?
Your spiritual center, whatever you want to call it, spiritual center, is shut down when you have a bad TMJ.
Yeah. You know that our TMJs are very much correlated with all actions in our brain. Also, this is fine, fine vibrations or fine movements within the brain bones. You have learned by the kinesiologist, I think you've heard about it.
Cranial rhythmic impulse.
Cranial rhythmic, you know about the cranial rhythmic. And the cranial rhythmic is a very big problem, for it's very hardly connected with our T's and especially with our TMJs. So all the tension we have here in the muscles, the tension we have in the joints, either connected that the brain gives impulses here, or vice versa again. Our stress here, our tension here, again, gives impulses to the brain. So there's a very strong interaction between these two. Here I have some pictures of the TMJ again, of the area. These are trigger points. This is of the book of Simons and Travell. You have heard about this very fine trigger points manual. And I have some more pictures about it. They only had the trigger points elaborated, and they gave us the idea to treat trigger points. Trigger points in this way, especially the oral or the chewing muscle trigger points. By injection from outside, you see here's a technique that you can get the tailgate muscles and give injections there, but you understand that our technique, the use inside the mouth, is much more elegant and much more acceptable for our patients, and that it does hurt less our patient. And therefore I recommend you to do the same inside the mouth. I have another picture on it. Here again, it's from the book of Travell and Simons, how to do, gives injections here at this point. If you use it as acupuncture point here outside, Remember the perpeting we had just now with our colleague here. We can do it only by touching, triggering the point, and have a superficial needle or injection there. But this is a deeper injection for the try to come inside the mouse, to touch the muscle inside the mouse, and it is a deep injection that is done here. And injection of trigger points in the masseter muscle. And so you see here the method as it is described in the very famous book. In my opinion, you can do the same in a very more simple way if you use the points inside. And especially if they are painful on pressure, do it from inside. Maybe talk about right and left brain, if you are interested, because of, you gave me the question. Nee, ik heb ze hier. Dat is zo. We know that we know that our right and our brain, our left brain, are quite different. Normally, our left brain is a thinking brain, the brain of the abstract thinking. You say abstract?
Mm-hmm.
The thinking which can analyze, which can interpret, which can plan, and all this what we call the ratio. It's the ratio side. Here it is. Here it is. Put it. Now it's in German, but doesn't matter. You can read it left, links, right, same, R, anybody can write it in English on it. Ratio here again, it's the verbal side. Here we have the verbalization, the analytic thinking, analytic, you can read here, that our left side for most of our population, all these abilities are concentrated in our left brain. Our right brain is quite another one. Our right brain, very difficult to understand because we never had realized it before, that the right brain is this one which has quite another approach to all experiences than the left one. They had lots of experiences, especially here in the States. Psychologists in California, they gave, for example, students lots of slides in a very short distance. Slide, new slide, short intervals, for about 400 slides. And then they chose of these 400 slides 100 and took a new series of another 100 slides and gave them on the next day. And they had to push a button down if they recognized slides they'd seen the day before, and the result was about 90%, in spite they had seen it very shortly. So you would not have realized by your ratio brain, by your left brain, but your right brain had the feeling, I know it, I have seen anywhere. It's like, you know the word déjà vu, I've seen it. It's well known for me, it's nothing strange for me. And many of things we meet in our life, you have the feeling, oh yes, I have heard about it, I know about it. It's like an inner knowing, an inner knowledge. And so this right brain is an intuition, is a verbal kind of knowledge, and moreover it's a holistic, the knowledge which can get all information in a holistic way. This analytical goes from the whole to the detail. You can, like our thinking is, like analysis is in chemistry, we take smaller parts and smaller parts and smaller parts, and we have the chance to get to the smallest unit, and that would be, in our belief, the atom. And then we might have all, and we would know everything about it. But the right side says, I can get it quite another way. And Asiatic thinking was always more directed or more done by this more intuition about. You are learning or you are registering things by symbols. Think of an Asiatic people, if they write, they don't write as we do, Chuck, A, C, B, and better a short, what do we Kurzschrift?
Shorthand.
Shorthand. We like to have shorthand, as short as possible, only give a little this. But they paint if they write a letter. They would sitting here and paint fine pictures if they had such a lecture, isn't it? So they train during their life very much the right side. For they like to paint. They like to see the whole. They like to see the symbols in it. They see the analogies. They have a deeper understanding for analogies. We never had it before. Before I had learned something about acupuncture, I didn't know what an analogy is. I only knew, think of it, analyze it, reflecting, and very abstract thinking was for us the best way to learn, the best way to solve our problems. But as the balance again, think of this symbol of balance. The balance in mankind is best done if we live 50% by the one side and 50% by the other side. So it may be balanced. And civilization means that we are overburdened on left side and that we are very empty on right side. Isn't it? And our impulses from the brain may be connected also with the TMJs. That's a different activity of our brains, left and right side. Left and right side of the brain also comes down to the TMJ as well as to the ears. In ear acupuncture, we will talk about tomorrow, there's a phenomenon that we, in many cases, only have to treat one side. You remember that I told you I like to treat normally both sides, to harmonize. But in ear acupuncture we have learned that one side can be sufficient. And in this case we use a so-called, there's a dominant side and what's it? Contrary of dominant. Recessive. And receptive side. And so you can find out what side has to be treated. And this can be better than treating both sides. And it depends again on these two brains. And the same phenomenon as we have in ear acupuncture, that one side can be stressed more than the other one, so that it gets dominant. This phenomenon, in my opinion, and also Diamond taught me about, the kinesiologist of New York, that this phenomenon can also be found in the TMJ. And therefore, balance again is not only balance in our muscles, in our chewing muscles, balance has also to be realized in our brain. And for us, as civilized people, we have problems to get balance here, between right side and left side. But maybe that you have time tomorrow to talk a little more about our functional circuits, so you will learn that if you look at in the view of acupuncture, the one side, which is the thinking side, is very much correlated with the functional circuit of spleen. Spleen is a thinking organ. And this other side, the right side, brain, is very much connected with intuition, and the intuition organ is lung. Lung intestine, large intestine. So again, you have these two sides of our brain are the same that cross in our oral cavity. These two here. You see, they cross here. Large intestine, lung, spleen, stomach. The brown one and the blue one here, they cross. You know it from the chart for Dr. Fall and Dr. Kramer. And this crossing, in a way, is very symptomatically for this relationship between our right and left brain. The new researchers now have found out that they don't act so singular as we now first had the idea that this is only left and this is only right, that there is a steadily interaction between both. But this impulses from the one side is very weak and the other side is very strong, so there's no balance in it. And how can we get a better balance? That's really difficult for us. We have to activate this side, which is an intuitive one, and it is the side of lung. Lung is breathing. It is the side of letting go. For you know, large intestine and lung is a function. Think of it, breathing is inhaling and exhaling. And large intestine is again an organ. Think of the babies, what do they do? The first present to the mother is, what do they go? They cannot give some other, they only can give it. It's the first present they give to the mother. Say, yes. And constipation is this problem. Constipation is a problem of the large intestine, of not letting go. Lung and large intestine are the organs they have to learn to let go. Asthma, the asthma problems, they're very much connected to this problem, that we have not learned to letting go. Again, the right side is quite another interest. I'm interested, I'm active, I control it, I want to take in. I am a very integrating person, integrating other things. And for this side it is allowed. It's normal. I have to take my information, I have to take spleen, my digestion, in my stomach, by integrating it. It's very normal. This side is allowed to integrate, is allowed to take in, is allowed to control. But this side is quite another one. It has a special ability to let go. And if we have never learned to let go, for we are a very material society. You know what I mean? So we are not only because of our thinking, because our not being able to letting go, we are really such people. We have no balance in our brain. And as long as we have no balance in our brain, we will have problems, we will find many problems also in our TMJs. In our mind, in our psyche, not only in the mind, also in the psyche, and also in the functions of the organ, of our organs. And the first organ connected may be the TMJs and our chewing muscles. There's only one approach thinking of it. But as we are here dentists, we have to realize that this also impacts our field. That we not only think of tension, trigger point, gone, okay, but we have to realize what is the deeper impulse, in many cases, behind it. I think maybe tomorrow we have time to talk a little more about the functional circuits and their special actions, only that you remember that this phenomenon is a deeper phenomenon of this crossing here. Fine. Some more questions?
Do you find it useful to use electrical stimulation or
The question is of electrical stimulation. You know, in acupuncture, the points can be stimulated electrically. And in special pain conditions, it can be very useful to do it.
We have the diagnosis from each patient, and Dr. Kramer would like you to
Oh, fine.
look at the patients.
We do now.
And I think
Okay.
we can all learn about that.
Yeah, but we have no time for the overhead projector.
Well, just talk about it.
Let's go through it all. Exercise. Yes, you did, Bob.
Dr. Kramer will tell us about the patient.
Looking for particles and the point of the moment.
How do you make the transparency? How do you make the leaks?
Very simple.
What?
You can run it through a copy machine, the transparency in the copy
Will it go on
machine.
the acetate?
Yeah.
Yeah.
Okay, no problem.
No problem?
No
Okay.
problem.
Right.
How many do you want to make?
That's why we make this whole stuff that way.
Do you want this, you need a copy machine of it?
Okay, you got the right address. Only copy. Only, as you get into the case.
What about this one? Two.
Both.
Another acetate.
Yeah.
Give an answer.
While we're waiting here, I'll fill you in a little bit on the issue. By the way, while we were up there, we learned something on Ed's
Come here.
on the pulp tester that you may be ordering or using. Dr. Cromer found out something very interesting is that when we use the pulp tester on Christine here, the readings that he got for the mandibular noso were very high. He usually says he usually gets about a D5 reading to balance out. He did the balancing first with a tonsil palatina, and then he went to mandibular noso after stimulating. Then he went to D5, which it normally balances out to get a normalization. He couldn't get it. He got a D8, as I recall. He can cross-correlate this with me, and he was very puzzled by this. And what we found out was that it was the medium that was used in the pulp testing. I think it was a toothpaste that Dr. Ernst had used in his room there that they used as an intermedium, and it may have been the fluoride or some material in the toothpaste itself that was causing the distortion. So Dr. Cromer suggested that we be very careful when you're doing your pulp testing procedure, that when you go from your pulp test to your dermatron or your electroacupuncture testing, that you be sure that you're not using material that will upset the measurement. He was very puzzled by this.
That material had fluoride in it, and I hadn't even thought of that.
Yeah,
And
so
I've been using it. That's what they sent with the machine.
So I mean, that's how sensitive, but I mean, it was interesting how he picked it up with the no-so D8 is how he picked it up, because he knew what it takes to balance the circuit system, and he couldn't figure out why it was reading so high, and that was pretty interesting. Christine is a patient of mine. I checked her with the dermatron and found her to have a number of Q series nosos, Staphyloforma nosos, relating to osteitis, a bone infection, and root canal problems. I mean, she had probably the most Q series that I've seen on a patient. She had complaints, and I'll let her go over some of the problems that she had, but she presented with complaints on the left side of her body, but she was referred to me by an acupuncturist who took her through a series of acupuncture, helped her, but could not really bring her up. She had problems on her left side. She had a root canal approximately 10 years ago performed, and I'll let her give you that history. We also found that she had some problems. You wanna go over your history with the group? I'll let you.
Sure.
The root canal was done on tooth number 19, and it was substantive. Apparently it was done three times, I take that back. And it was finally, after a year and a half period of time, extracted. There are also some other problems that Dr. Cromer picked up also, and the problem that I'm dealing with at this point as a dentist is that she had a bridge. This was her second bridge apparently done by a dentist who apparently the bridge from a structural standpoint was a 300 gold bridge, looked very good. There was no problems that I could see structurally on the bridge. And the problem is that it was the second time she had the bridge redone, and she wanted me to do the bridge third time. And at that point I stopped, and I decided to go to the testing, electroacupuncture testing, to determine why she didn't tolerate the second bridge. And I'll let her give you a little history on that.
Okay, the situation with that bridge right now is it was taken out, and I have a temporary, and the discomfort in the left lower part of my jaw has continued, and that was a puzzle, and that was what led us to go ahead and look into what was actually happening in my lower left jaw. apparently now I have some TMJ also. I'm not clear as to what the source of that is. The problems that I've had have really been the left side of my body, my left ankle, left hip, left side of my neck, my left hand was numb for a while, and indeed pain and discomfort centralized in the lower left jaw. It's hard to remember actually everything that's gone wrong. It's just sort of like the left side wasn't working. I don't know what else.
Did you test her with mercaptan and thioether?
Yes, I did. She checked out. Let me see, I'll tell you. I'll go over all the NOSOs that she checked out as being ridiculous. Okay. Usually when I check out a patient, I'll find maybe on the dental NOSOs maybe 4 or 5 Kusers that will check out or something. She had the following: noso radicular cyst, noso kieferostitis, mercaptan, amalgam, paralysis, which is staph aureus, thioether, Catarrhamus flora, exudative osteitis, osteosclerosing kieferostitis, nosoperiodontitis, nososclerosing osteitis, nosochronic pulpitis, formaldehyde solution, penicillin, and ritualbanzone, which is root canal, and acute pulpitis. So I mean, those are quite a few. At that point, I decided, rather than doing a bridge, I think I'd stop. So one of the things that I'm concerned about is the fact that she did have this root canal. It was a chronic and acute trauma that occurred over a period of time, which left a situation where I may have to go in there and do the surgery to possibly clear out that area. Plus, she had problems in the ponic areas of the 3-unit bridge. They're on X-ray here also. Now, she has also other problems that Dr. Cromer did pick up, and he'll probably elaborate on that. But at this point, I think you can see that there's a number of problems related to tooth and jaw area that need to be addressed before you decide to do a 3-unit bridge, in which case I think it's going to be then modified from this point.
Wir haben bei dieser Patientin einen Elektroakupunkturtest gemacht, solange Dr. Gleditsch hier referiert hat. Und
we gave this patient an electroacupuncture test while this afternoon session was going on.
Wir haben dabei festgestellt, dass alle Zähne vital sind.
We found that all teeth are vital,
bis auf 5 unten links.
Except number 5 in the lower jaw on the left side.
Auf diesem Zahn ist eine Behelfsbrücke.
It has an auxiliary bridge.
Die geht bis auf 7 unten links.
Which lasts until number 7 of the left lower jaw.
Und überdeckt die Zahnlücke bei 6 unten links.
And covers a gap of tooth number 6.
Wir haben dabei festgestellt,
we found
dass der Zahn 5 unten links tot sein muss, also abital sein muss.
Number 5 of the left lower jaw must be dead.
Das ist aber nicht genau zu klären, weil wir keine neuen Röntgenbilder hatten.
But we couldn't really say because the X-ray is rather old.
Die Röntgenbilder sind über 1 Jahr alt.
Older than 1 year.
Und hier ist gleich das erste Problem für den Elektroakupunkturzahnarzt.
And here you have the first problem for the electroacupuncturist.
Man sollte mit alten Röntgenbildern keine Elektroakupunkturdiagnostik machen.
Don't diagnose on old X-rays.
Also ich habe hier eigentlich einen großen Fehler gemacht.
So actually I made a great mistake.
Aber weil ich die Röntgenbilder ja heute nicht nachholen kann,
but I can't have a re-X-ray,
habe ich es trotzdem versucht.
So I just gave it a try.
Aber um Schwierigkeiten zu vermeiden, bitte ich Sie inständig, das nicht mehr zu machen.
But may I ask you not to do so, because you get a lot of difficulties.
Machen Sie nur Elektroakupunkturdiagnostik mit ganz neuen Röntgenbildern.
When you do electroacupuncture, make sure that the X-rays are very recent.
Sie können das hier schon sehen, dass diese Röntgenbilder gemacht wurden, bevor die alte Metallbrücke entfernt wurde.
You see, these X-rays were made before the old metal bridge was removed. You see it here.
Also, unsere Diagnostik ergab dann,
Our diagnosis read
unsere Diagnostik ergab dann, dass dieser stark deutlich behindert ist.
that this particular tooth is a strong focus.
Na, auf diesem Schema stellen wir leichte Behinderung so dar.
We mark a slight focus like this.
You can't see.
Uh,
So, ist besser?
Yeah, it's better.
Und eine mittelstarke Behinderung so.
and a medium one like this,
Und eine starke Behinderung so.
and a strong one like this.
Ja? Eine
So-
schwach, mittel, stark.
This is how we mark this.
Damit wir das sofort übersehen können.
Well, so we have a quick
Und wenn
survey.
wir jetzt in unseren Testbereich gehen, stellen wir fest,
And in this chart you see I entered
dass der wurzelbehandelte Zahn 5 und links eine mittlere Behinderung hat.
a medium focus with this root-filled tooth number 5.
Und zwar eine mittlere starke Behinderung, die bis in den Kieferknochen geht.
It is medium strong and it extends into the jawbone.
Leider ist auch eine mittelstarke Behinderung festzustellen in der zahnlosen Strecke 6 unten links.
Unfortunately, also where the gap is, you have a medium focus in the bone.
Wir würden hier die klinische Diagnose Restusditis stellen.
And clinically, we would say it is a persisting osteitis.
Na, Restostitis, we say.
Resisting.
Resisting.
Also eine verbliebene chronische Knochenentzündung.
It has stayed after tooth removal.
Nach meiner Erfahrung ist diese chronische Knochenentzündung entstanden,
To my experience, this resisting osteitis came about
weil nach der Zahnentfernung der Knochen nicht gut ausgeheilt ist.
Residual.
residual. Because after extraction,
Weil nach der Extraktion die Knochenwunde nicht richtig ausgeheilt ist.
the wound in the bone did not heal properly.
Und weil wahrscheinlich
And because probably
keine biologische Nachbehandlung erfolgt ist.
there was no post-treatment in a biological sense.
Nach unserer Erfahrung in Deutschland
According to our experience in Germany,
bringt eine gute Zahnentfernung, also klinisch klare Zahnentfernung,
if you remove the tooth properly as demanded clinically,
ohne biologische Nachbehandlung,
but you fail to have post-operative biological treatment,
bei einem ohnehin geschädigten Patienten,
if the patient had trouble before,
wo also das Grundsystem schon vorgeschädigt ist,
which means that his basic regulative system was pre-trouble,
50% Erfolg,
you only will have 50% of success
aber nicht mehr.
and no more.
Und den Rest der weiteren 50%
And the other 50%
für eine gute Heilung
that you need for good healing
müssen Sie erreichen durch biologische Nachbehandlung.
can only be achieved through post-treatment in a biological way.
Also Herdtherapie bedeutet
Focus therapy includes
klinisch korrekte Zahnentfernung
clinically correct tooth extraction
und ausreichende biologische Nachbehandlung.
and a satisfying biological post-treatment.
Nun, hier ist noch ein Problem bei der Patientin.
Another problem with this patient,
Der Zahn 7, der zweite Molar,
the second molar
links unten,
of the left lower jaw,
hat nach Elektroakupunkturtest
according to the electroacupuncture
eine
test,
chronische Pulpitis,
has a chronic pulpitis,
und zwar mittlerer Stärke.
medium grade.
Man könnte versuchen, eine konservative Behandlung dieser chronischen Pulpitis,
You could try to treat this conservatively,
zum Beispiel mit Calciumhydroxid.
for instance, with calcium hydroxide,
Aber mit dieser starken Belastung, wie ich sie bei Elektroakupunktur festgestellt
but
habe,
seeing the stress as found in the electroacupuncture test,
Na, wird diese konservative Behandlung der Pulpa nicht gelingen?
I do not expect this conservative treatment to succeed.
So habe ich hier auf der Tabelle festgehalten,
That's why I marked
dass auch der zweite Molar links unten zu entfernen wäre.
that I would advise the second lower jaw molar to be removed
Wenn ich persönlich diese Behandlung durchführen müsste.
if you were my patient.
Nun noch ein Problem.
Another problem.
Auch links unten.
Also in the left lower jaw,
Na, eine Restoschitis besteht ebenfalls
there is
in der
another
Weisheitszahn.
residual osteitis in the wisdom's tooth area,
Na, und die ist auch mittlerer Stärke.
also medium grade.
So sehen Sie, wir haben eine durchgehende ein chronisches Krankheitsgeschehen von 5 bis 8 unten links.
So you see all over the place from 5 to 8 you have a chronic residual osteitis.
Also ist der ganze Magen-Darm-Trakt mitbeteiligt.
That means that all the intestinal tract is included, involved,
Zusätzlich Herz- und Kreislaufgeschehen.
as well as heart and circulation function.
Also wir würden bei uns in Deutschland im Slang sagen, hier unten ist ein dicker Hund begraben.
We would say, in our German slang, we would say, a very fat dog was buried here.
Nun, der Fall ist insofern auch für mich interessant,
For me, it is very interesting.
dass von den übrigen Weisheitszahngebieten
The other three wisdom teeth areas,
rechts unten,
for instance, in the right lower jaw,
der ja kein Weisheitszahn mehr hat,
no more does she have this wisdom tooth.
eine chronische Knochenentzündung besteht mittlerer Stärke.
There also is a residual osteitis of medium grade,
Und auch links oben
the same as in the left upper jaw,
im Weisheitszahngebiet eine mittlere chronische
medium
Knochenentzündung besteht.
grade residual osteitis of the wisdom tooth that was removed.
Nur die chronische Knochenentzündung, nur beim Weisheitszahngebiet rechts oben
Only with the wisdom tooth of the right upper jaw,
besteht eine schwache chronische
the
Knochenentzündung.
residual osteitis is low, but it is
Diese
there.
beiden chronischen Restostitiden, rechts unten im Weisheitsgebiet und links oben im Weisheitsgebiet,
The chronic residual osteitis of rechts unten,
und links oben,
of the left upper jaw and the right lower jaw
können Sie nur auf chirurgischem Wege entfernen.
are too strong, so you have to do surgery,
Einschließlich biologischer Nachbehandlung.
including a biological post-operative treatment.
Die leichte chronische Knochenentzündung im rechten Oberkiefer
The slight chronic residual osteitis
würde ich
in
persönlich bei der Patientin
the right upper jaw.
auch operativ angehen.
In this case, I would also prefer to do surgery on,
Aber wenn Sie Kompromisse machen wollen oder müssen,
but if you have to compromise or if you wish to compromise,
dann können Sie das erstmal zurückstellen.
this is not so urgent here.
Also Sie sehen, wir haben im Weisheitszahngebiet und unten links unsere starke Beerdung.
So you see, foci are present in the regions of all four wisdom teeth, as well as in the lower jaw on the left side, from 5 to 7.
Es wäre ja nun interessant zu sehen, wie Herr Gleditsch diesen Fall beurteilen würde.
And I would very much like to know what is Dr. Gleditsch's impression.
Noch ein Hinweis sei gegeben.
Another hint.
Warte mal, wo haben wir dieses Original habe ich nicht hier. Kann ich das Original haben?
May we have the original, please?
Das ist etwas genau. Noch ein weiterer Hinweis muss gegeben werden, dass der Vierer oben rechts, dieser Zahn hier,
Number 4 in the upper jaw on the right side
eine deutliche Belastung hat im Sinne einer chronischen Pulpitis.
also has a chronic pulpitis.
Aber diese chronische Belastung ist aber nicht übermäßig stark.
but not too strong.
Und ich würde hier versuchen, mit konservativen Mitteln vorzugehen.
Here I would try to go at it conservatively.
Also indirekte Überkappung.
That is an indirect, ja, was ist Überkappung?
Cover to pulp.
Ja, indirect pulp cap.
Indirect pulp cap
mit Calciumhydroxid.
By means of calcium hydroxide.
Ich meine, das müsste gelingen.
I think that ought to succeed.
Und ähnlich ist es auch hier mit den beiden Zähnen 6 und 7 oben links.
And similarly, this applies to the teeth number 6 and 7 in the right upper jaw.
Der Zahn 6 oben links hat eine große
Left, I'm sorry, it's the left side. Because number 5 tooth has a big, 6 has a big synthetic filling.
Diese würde ich unbedingt nochmal herausnehmen.
I would like to remove that one.
Schauen, ob darunter nicht doch noch Sekundärkaries ist.
Find out whether below, underneath, you'll find a secondary caries.
Auf jeden Fall tiefer ausbohren als bisher.
I would go deeper with my boring than has been done up to now.
Und dann auch wieder mit Calciumhydroxid überdecken.
And I would again like to cover this one with calcium hydroxide.
Und darüber wieder eine Zementfüllung.
And put a cement filling on top.
Dasselbe würde ich beim Zahn 7 oben links machen.
The same I would also do to tooth number 7 in the left upper jaw.
Der Zahn 7 oben links hat zurzeit eine Goldkrone.
At this moment it bears a gold crown.
Und wenn Sie ganz korrekt vorgehen
and
wollen,
if you want to be quite correct,
dann müsste man eben diese Goldkrone entfernen.
You also ought to remove this gold crown
und später durch eine neue Krone ersetzen.
And replace it later with a new crown.
Aber wie gesagt, diese 3 Zähne.
But as I said, those 3 teeth.
4 oben rechts, 6 oben links und 7 oben links.
4 upper jaw right, 6 and 7 upper jaw left.
Sind von untergeordneter Bedeutung.
Are not of primordial importance.
Die Prozesse im Weisheitszahngebiet.
The processes in the 4 wisdom teeth areas.
Und vor allem unten links.
And most of all on the left lower jaw.
Stehen absolut im Vordergrund.
Are very much superior.
Nun werden Sie fragen, wie ich persönlich hier mit der Therapie vorgehen würde.
You may wonder what would be my therapy.
Na, ich würde zuerst den Oberkiefer sanieren.
First of all, I would start to cure the upper jaw.
Also beispielsweise das obere Weisheitszahngebiet links
For
chirurgisch
instance,
sanieren.
Do surgery on the upper wisdom tooth area of the left
Und
jaw.
dann würde ich auch gleich diesen kleinen Prozess rechts oben im Weisheitszahngebiet mit sanieren.
And at the same time I would do the wisdom tooth process on the right side, upper jaw.
Also in der gleichen Sitzung.
In the same session.
Und würde in meiner Praxis jeden Tag eine mit Elektroakupunktur kontrollierte Nachbehandlung machen.
And I would check her every day by electroacupuncture subsequently.
Und dann dem Patienten eine Therapie mit nach Hause geben mit Hilfe von Hehltropfen zum
And
Beispiel.
I would make her have drops of some heal remedies.
Die der Patient jeden Tag früh, Nachmittag und Abend einnehmen soll.
To have them in the morning, in the afternoon, and at night, 3 times.
Das ist dann eine Kompromisstherapie.
That is a compromise therapy.
Aber ich kann ja den Patienten nicht 14 Tage in meiner Praxis behalten. Der muss ja wieder nach Hause.
I could not keep her in my office for 2 weeks. She has to go home meanwhile.
Na, wenn diese Behandlung durchgeführt ist,
when this is achieved,
müssen Sie wenigstens 6 Wochen warten.
You have to wait for at least 6 weeks.
Damit die Ausheilungsprozesse hier bei den beiden Wunden abgeschlossen sind.
So to make sure that the wounds have healed properly.
Und dann würde ich nur eine Seite im Unterkiefer operativ entfernen.
And then I would do only one side of the lower jaw.
Ich würde dabei den rechten Unterkiefer zuerst machen,
I would prefer to do surgery first on the right lower jaw
weil das der geringere Prozess ist.
because it is the smaller process.
Ich würde aber auch hier wieder eine Woche nachbehandeln.
Again here, for 1 week I would have post-operative treatment,
Unter täglicher Kontrolle.
and this includes everyday check of electroacupuncture.
Und wenn diese Behandlung abgeschlossen ist,
When this week has elapsed,
würde ich wiederum 6 Wochen warten, mindestens oder länger.
I would again wait for 6 weeks, at least 6 weeks, perhaps even longer.
Oder länger. Und dann erst würde ich den linken Unterkiefer, wo der dicke Hund begraben ist, annehmen.
And then, only then, I would attack the fat dog.
Also ich würde die Therapie nicht so machen, dass ich den schlimmsten Prozess zuallererst angehe.
I would not start with the worst part of it.
Der Patient möchte immer den schlimmsten Herd zuallererst haben.
The patient thinks he wants to have the worst focus removed immediately.
Aber wenn Sie mit diesem Prozess links unten beginnen
But
würden
if
bei
you
der
would do
Operation,
so, if you would start with that surgery,
dann würde der Körper versuchen, hier alle seine Probleme loszuwerden.
the body would try to get rid of all its problems via that area,
Und Sie würden hier die größten Probleme in der Nachbehandlung haben.
and that would make post-operative treatment so complicated.
Und ich kann nicht einsehen, dass Sie sich die schlimmsten Probleme in die schlimmste Stelle hinein projizieren.
And I don't see why the worst problems that could crop up should be projected into the worst area of the body.
Wenn Sie dagegen die anderen leichteren Prozesse zuerst machen,
If, however, you start on the easier and not so hard problems before,
dann gelten die Nachbehandlungen, die Sie hier gemacht haben,
the post-operative treatments that you apply
zugleich als Vorbehandlung für diesen scharfen Prozess.
also are a pre-surgery treatment for the big surgery to come.
Und Sie werden sehen, dass das dann sehr viel leichter geht.
And then you will see the last bit will go very much more smoothly.
Sie müssen also den Patienten aufklären, dass Sie die Behandlung so machen wie die Katze um den heißen Brei.
So you have to inform the patient that treatment goes the same as the cat who walks around a hot pot of milk.
Dabei ist noch zu bemerken,
And then you have to add
dass die Behandlungen, die chirurgischen Eingriffe im Oberkiefer in der Regel weniger Probleme machen als die Operationen im Unterkiefer.
as a rule, surgery in the upper jaw does not give so many complications as in the lower jaw.
Und so beginne ich immer, wenn es irgendwie möglich
So
ist,
if
im
possible,
Oberkiefer.
I like to start in the upper jaw,
Eben damit ich die Komplikationen möglichst nicht habe.
to evade complications as much as possible.
Haben Sie dazu jetzt noch irgendwelche Fragen?
Any questions?
Ja, bitte?
I would like for you to go over the process for myself and the group of how you check with the electroacupuncture during the surgery. Do you filter out first with palatine, tonsil, and maxillary? Do you balance first before you treat, before you have the patient anesthetized and you do the surgery, and then you check when you go over your procedure?
Also wenn Sie nicht genau wissen, ob Sie den Prozess im Kieferbereich genügend entfernt haben,
If you are not quite sure whether you have removed the process in the upper jaw sufficiently,
können Sie während der Operation,
during surgery,
also solange die Wunde noch nicht zugenäht ist,
that is, before you have sewn the wound,
können Sie unter das Elektroakupunkturgerät gehen.
you can be so unter das Gerät.
Also an das Elektroakupunkturgerät gehen.
You can use the electroacupuncture.
Nicht darunter. Und Sie können dann Tonsilla palatina ausgleichen,
You use tonsilla palatina to balance,
wie ich Ihnen das gestern gezeigt habe.
to start with, as I told you yesterday, to neutralize.
Dann geben Sie einen Reiz auf die Operationswunde
Then you stimulate the operation wound,
und dann gleichen Sie wiederum aus mit Organpräparat Mandibula.
And then, in this case, you try to normalize with mandibular.
Und wenn der Ausgleich des Reizwertes gelingt,
and when you have normalized,
zum Beispiel mit Mandibula D6 oder D5,
for instance with mandibular 6x or 5x,
dann haben Sie einen sehr guten operativen Eingriff gemacht.
That proves that surgery was very good.
Und würden nach menschlichem Ermessen keine Probleme in der Nachbehandlung bekommen.
So you are liable not to have any complications.
Wenn Sie eine D4 nur erreichen,
if it is only 4x,
dann kann das ausreichend sein.
That may be sufficient,
aber es ist nicht exzellent.
But it is not excellent.
Wenn Sie aber an den Ausgleich machen müssen mit D3,
if you have to go down to 3x,
also nach dem Reiz zum Ausgleich einmal Mandibula D3 brauchen oder gar mehrmal D3,
or even you want several ampoules,
dann ist der Eingriff noch nicht beendet.
Or if you even want several ampoules,
dann sind chronische kieferostitische Prozesse in der Wunde noch zurückgeblieben.
Surgery is not finished, but there is some more residual osteitis in the jawbone.
Ich erinnere mich sehr gut an die 50er Jahre, als ich noch mit Dr. Voll eng zusammengearbeitet habe.
I remember when working together very closely in the 50s with Dr. Voll.
Da hatte ich eine Patientin von ihm.
I had one of his patients.
Und da habe ich operiert.
And I operated this lady.
Und ich wusste und ich konnte es auch noch nicht so mit so viel Erfahrung, mit genügend Erfahrung.
And I had not enough experience yet.
Und dann habe ich ihm gesagt, mein Gott, ich habe jetzt schon so tief operiert.
And I told him, oh, I have carved so deep into the bone now.
Und ich wollte nicht dann in die Nähe des Mandibularkanals gehen.
And I did not want to attack the mandibular channel.
Das war links unten, das steht noch von oben, weißt du?
It was on the left lower side.
Und dann habe ich den Dr. Voll angerufen und habe gesagt, verdammt nochmal, das geht so tief runter.
And I phoned Dr. Voll and I told him I have to go so deep into the bone.
Und wenn ich nachmesse, dann nachkontrolliere mit Elektroakupunktur, kriege ich immer noch einmal den 3.
But my test still shows 3x.
Dann hat er mir kurz und bündig am Telefon gesagt, dann operiere eben weiter.
And then all he said on the phone was, go on operating.
Und das habe ich dann natürlich auch gemacht.
And I did.
Ich habe dann allerdings eine leichte Parästhesie bekommen.
But a slight paresthesia was affected.
Und musste diese Parästhesie eine Weile mit Gelsenium und Organpräparaten Nervus trigeminus und so weiter nachbehandeln.
And it took some time to treat this paresthesia with calcium and nervous trigeminus and other remedies. And in the first place, arnica.
Ja, und dann haben wir diese Parästhesie auch innerhalb von ungefähr 3 bis 4 Wochen wegbekommen.
But and then it disappeared within 3 or 4 weeks.
Also sowas kann natürlich schon mal passieren, wenn man so nah an den Mandibularkanal oder direkt an den Mandibularkanal herankommt.
So you see, this can happen if you get very close to the mandibular channel or if you even touch it.
Wenn ich sonst die Restostitis meistens ausbohre, mit großen Bohrern, aber langsamer Tourenzahl.
Whilst in most cases I like to bore in the bone with great big frays and very slowly, not using the turbine.
Never, niemals benutze ich die Turbine zur Operation.
Never the turbine.
Das ist ein Mistake, wie es größer nicht sein kann.
It's the greatest mistake you can make.
Also bei der Operation kann man keine Turbine gebrauchen.
Fritz, you want a button? Turbine?
Yes, I like to have it. No turbine X, and in the middle, no fluoride. I think this is the first and the rest I wait for the next.
Why do you use the Unterkiefer instead of the Overkiefer when you're testing this after you're doing the surgery on the maxillary?
Also im Oberkiefer kann man leichter operieren.
It is easier to operate in the upper jaw.
Weil der Oberkiefer am Kopf fixiert ist.
Because it is fixed in the head.
Und die Mandibula, der Unterkiefer.
While the mandibular, the lower jaw.
Der ist locker aufgehängt.
Is suspended in a loose way.
Und Dr. Gleditsch hat Ihnen heute früh gesagt, wie viele Punkte man hier im Unterkiefer zu berücksichtigen hat im Mund.
And you already have seen how many points there are to be registered in the lower jaw, in the mouth, we heard this morning.
Also es ist ein funktionelles Problem und ein funktionelles Problem und auch ein mechanisches Problem.
It is both a functional and a mechanical problem.
Denn Sie müssen immer schlucken.
Because you always have to swallow.
Und dadurch kann man den Unterkiefer nicht so ruhig stellen wie den Oberkiefer.
And so it does never stand still.
Yeah, but I thought you said he was starting with the surgery on the upper jaw, but you said he was testing with the Unterkiefer to see if he'd gotten it all out.
Did you say verschiedene Fälle?
Das sind zwei verschiedene Operationen.
This was different cases. The second story was about a different case.
Yes, I'm sorry. I interrupted him. I'm sorry. But I was asking about non-patient.
Also ich mache ja die Operation nie im Oberkiefer und im Unterkiefer zugleich. Also möglichst nicht im Oberkiefer.
If possible, never on the same day do surgery in the upper and in the lower jaw.
Wenn es irgendwie möglich ist, vermeide ich das.
I try to avoid this.
Ja. Noch eine Frage, bitte?
Yeah. If you're using, instead of mandibular homeopathic, if you use organ preparation, if you use jaw osteitis, what would you find? Could you use jaw osteitis?
Ich benutze zur Nachbehandlung immer die Trias, das habe ich gestern schon mal gesagt.
For post-operative treatment, I always use the 3.
Ich benutze das Organpräparat.
Organ preparation.
Also zum Beispiel Mandibula.
Mandibular, for instance.
Dann benutze ich die Nosode.
Nosode.
Zum Beispiel.
Jaw osteitis, for instance.
Und homöopathische Mittel, wie zum Beispiel Arnika.
And homeopathy, as for instance Arnika.
Oder homöopathische Kombinationsmittel, wie zum Beispiel Traumel.
Or homeopathic combinations like Traumel.
Und Lymphomyosod.
Or Lymphomyosod.
Und dann immer Drainagemittel.
And always, in addition, draining remedies.
Zum Beispiel Drainagemittel, wenn ich im Unterkiefer hier bei 6, 7, 8 arbeite, Drainagemittel, die für den Darm wirksam sind.
And if it were for the teeth of the lower jaw, 7, 6 and 8, it would be important the remedies drain the alimentary canal.
Und dann immer auch Mittel, die für das Nervensystem zuständig sind.
Also remedies that pertain to the nervous system.
Also wie zum Beispiel Gelsenium.
Gelsenium, for
und
instance.
Das Organpräparat Nervus trigeminus.
And the organ remedy of the trigeminal nerve.
Und dann ganz wichtig sind die Lymphmittel.
And very important are the lymphatic remedies.
Sie sollten zum Beispiel kontrollieren, ob individuell Phytolacca möglich ist.
Try to check whether individually for this person Phytolacca would be good.
Oder wenn Sie Kombinationsmittel einsetzen
Or if you wish to
wollen,
use combination
die
remedies,
für den Patienten billiger sind,
which are cheaper for the patient,
dann können Sie zum Beispiel versuchen, ob Lymphomyosod passt von Hehl.
Lymphomyosod by Hehl.
Also da hat man eine große Kombinationsmöglichkeit.
There's quite a range of combination that is possible.
Aber ich nehme niemals ein Mittel alleine,
I never take one remedy only.
sondern immer die Kombination, ich sage die Trias zwischen Organpräparat,
Always, as I said, the 3. One organ preparation,
Nosode
one nosode,
und
and
homöopathische
one
Mittel.
homeopathy at least.
Das braucht man. Und
That
ich
is
muss-
necessary.
Und ich muss immer an das Grundsystem von Fischinger denken.
And I always have to pay regard to the basic regulation system.
Ich muss was für das Grundsystem geben.
I have to treat that.
Ich muss etwas für die Lymphe geben.
I have to treat the lymph,
Für das
the
Nervensystem
nervous
geben.
system,
Und für den Kreislauf.
and the circulation.
Das geht besonders im Weisheitszahngebiet.
And that applies particularly to the wisdom teeth area.
Und da das größte Entgiftungsorgan die Leber ist, Leber-Galle-System, muss ich auch dafür was geben.
And as the organ which is most important for detoxification, I always have to think of remedies for liver and the zweite and gallbladder.
Und da ja der Darm ein ganz wichtiges Ausscheidungsorgan ist, muss man natürlich auch für den Darm geben. So kommen etwa 10, 12, 15 Mittel zusammen.
And the intestines being the organ of excretion, so you also will have to give some remedies in respect to that one, so that will sum up to about 10 to 15 remedies.
Aber ich persönlich gebe die Mittel nur, wenn sie ausgetestet sind.
But I will always test them before I give them.
So, ich glaube, wenn Sie keine Fragen mehr haben, dann nehmen wir noch den anderen Fall vor, oder?
If there are no more questions, do you want to discuss the other case? Or should the patient... sollte mein Mann erstmal bei ihr erstmal diagnostizieren?
Gern.
Okay. No, I think that would be good, and then...
We can do it, why not?
Okay.
Weil wir sozusagen das noch in
Ja,
den
ja,
Kopf haben.
ist sehr gut.
But we have learned that we cannot compare the methods because the points in the oral cavity, points in the thorax region, and all the others we talked about, there are points which come up if they are functional trouble, whatever it is, but not necessarily they come up if there is a focus. The focus in many cases is a chronic situation without any signals of the body, no red lamps, you know what I mean. And therefore in focus diagnostic you need such a very hard work as Dr. Kramer does. It takes time, and you need so many remedies, and you need the measurements, and if you will find out which of the teeth are to be removed, you have to go this way. But again, our points we can detect by palpating. They can give us a help in the treatment before we have our surgery as dentists. They can give us a good help after our surgery, and they can give us a very good hint how the situation is in our patient by the psychological view, by the view of the immune system, the lymphatic system, and if the special point of time when the patient had to be operated is suitable now or later. This information I can get in many cases. First again, you can do as you like, but I like to begin with palpating. I'm allowed to. Here again, not so much.
No.
Where does it begin? Here. It's not only 17, it might be 18 conception vessels, is it? I can go down a little. It's more here? Or this area?
Right there.
Thymus area, according to the kinesiologist. So maybe energy trouble. No, not astonishing that there are energy troubles, isn't it? After this, look there. And again here, not so much. Okay, the area of 17th, 18th conception vessel in the midline. We can have a little control here on the points, the side. We can check points at the stomach meridian. She doesn't like it. Is it more on the right side, left side?
More on the right side.
Right side.
Mm-hmm.
Yeah, can be.
Well, the left side's pretty tender too.
Both sides.
Okay, both sides.
Both sides. And let me have a little palpating. Am I allowed to palpate here?
Sure.
Here is painful?
No.
Not so much. and sometimes uses backshoe points of the large intestine and the kidney, only to have a little check-up if they are in a high degree painful, but they are not. It's okay. You can now even check in this area. She doesn't like it. Here again. Ow. Ow. You heard it? It's a very simple method. Ouch. But in our daily practice it can help because we have not so much time for measurement, which with all of our patients. But if we begin this measurement, so we have to do it so carefully as you do. I think it is a very good idea. Now again. The tonsils are spines. Did you have problems with your tonsils?
Always.
Often?
Always.
Always. Always trouble with your tonsils. Painful here? More the right side, more the left side. Have you seen the face? Right side?
Yeah.
Yes. Left side?
Yes.
Both. I have a little pressure now on the tonsils with the mirror. You see that? Can you see it? Yes. Here again.
You want a tongue bite?
Can you see?
Pus?
Pus from the tonsils. I have not the right instrument here, but there's a problem with the tonsils. You see it? Yes. Yeah.
Dr. Kramer did pick up tonsillar problems on
both tonsils.
energy testing. He didn't mention it.
Thanks.
The left one doesn't seem bad.
Cervical spine is okay. See? Movements are not restricted. Okay. And the Adler points.
This?
She doesn't like it. Look here. Cervical spine, it's in the level of 2 and 3, upper jaw, lower jaw, tonsils again. More upper and lower jaw. Here again, no? You feel it?
Less, but yes.
Yes, that's it. Okay. Now we have the palpation inside the oral cavity. Inspection of the mucous membrane. Everything is okay. If you're sensitive in a special place, we can see. Not so much here. Again here. There's a difference between left side, right side again, left side. Left side is a little more. But not so typical, yeah? There's a little more sensitive left side, but not as you might expect because of this diagnostic. It is not so typical, and we have to know it. The measurements give us a quite deeper information as that we can feel at the surface. We have our checkup at the surface, and the surface is more connected with all the body, with the functional circuit. Now we have the painting of the upper jaw. Here again. Here. It hurts. It hurts. Same right and left side. And last is the inside area. Both sides, left and right. It's the wisdom tooth area, buccally and lingually in lower jaw. In my opinion, she is stressed a lot by this focus. Pain here again? No. No pain at the midline, the back side? No. Okay, thanks. You see, the question is, if you would be ready to begin this operation, and I'm very much impressed by Dr. Kramer's findings, that he suggests to begin not at the dicker Hund place, the fat dog situation, but that he suggested to begin in the upper jaw, right side, left side, wisdom tooth area, right side, lower jaw, and then at last to take this more severe area. And again, as he has the same idea as I would suggest, that we first do this, what is most remote. So I would say first we have treatment here 2 or 3 times and wait if she recovers with this area. For this area here, you know, it's our psychological signal, but also as it is more here in this level, again, thymus defense system, so we could recover her and give her more strength on the psychological as well as of the immunological side by treating these points, by maybe treating these large intestine points and maybe the 2 points inside the mouth, or 4 points, 2 or 3 times, and have a control only by palpating. The next question is, and we talked about now at noon time, if we then might have a new control before we begin, new check before we, for it is a lot of work. Each measurement takes a lot of time, and it only gives 2 possibilities. It can be the same result, but the patient has changed in his points. So we can begin with the surgery. It can be a better result than here in some points, maybe. We talked about that we might have this check. We work together with some patients now in the future. If this is the case, the same, we can begin the surgery. So, either or, if it is changed or not in the measurement, if the patient is better with his points, we are ready to begin with our surgery. I think so. And we do our pre-therapy maybe with homeopathic remedies, is it? Question?
Yes.
Would you agree?
Would you start doing the surgery before you did anything to the teeth, or would you do the teeth first, then the surgery, as far as the third molars?
The surgery can be done, as you told us, in this sequencing. And this treatment here, the lymphatic treatment first, and including this lymphatic treatment, the tonsils. You have seen I would express the tonsils 2 or 3 times. I would give injections at the upper and the lower, maybe the middle pole, middle area of the tonsils too, to give her a stronger defense and immune system. Look here. These are the points again, according to Adler. This area, the lymphatic area, we have talked about the necklace here. This area is very painful also here. We have seen that all the necklace is very painful. And it would be better for our patient, and we would get better results if this area has improved. It would not be so painful. And as a pre-therapy. And would you agree that you have a pre-therapy by treating sternum points, by treating the lymphatic point, but not too many points, not to stress the patient too much. And we can combine this treatment, I suggest, with the idea of Dr. Kramer, that we now, for example, these remedies, these homeopathic remedies, he suggested, could inject in this point. For example, here, in the lymphatic points here, we could have our homeopathic remedies we have injected here. Also our organ preparations, tonsilla palatina, for example. Normally, electroacupuncture is used to give injections here in the gluteus muscle. I have seen in many patients it works very well to do it in these special points which are connected with our special area, in the mouth, in the tonsils, in the sinuses, and these points can be best be here in the arms, large intestine area, and in the necklace of the thorax.
Would you inject right into the breastplate here too?
If you treat the midline point, sternal points. Think of it, if they are so sensitive in such a high degree as we find it relatively often with our patients, that it may be important to give a little stronger stimulus. If we have a little superficial twaddle done, I used to give a stronger stimulus by also touching the perios. The perios? Perios. Czechoslovakia. He came to his hospital. He is a chief of a hospital and he has an own department for acupuncture with some nurses, and he does a very good work, Dr. Umlauf. And we looked at his work, and then he took us to the next room. It was the operation room, and he stood there like a surgeon with gloves here and fine surgeon yeah, and so we wanted to know. And he did an operation, and this operation was done here in the midline of the sternum again. He opened the skin, he opened the perios, he put in a little yes, he took a little gas at the spot, and this was operation. No more. Say what now? Yes, it might be hiding, it might be heal. Now secondary. You know what is a secondary? Yeah. It was not no sutura. It was not
primary.
Yeah. Not primary, but it was an open sore, an open wound. And this open wound stresses this area so much that especially in an asthma patient, they have seen a very good result. So think of it. Sometimes you have to stress really this area to get better results in acupuncture. But these are special cases. But only for me it was very interesting to see that there is surgery at the sternum. And therefore in many cases it is such a high degree sensitive. I not only give this typical superficial quaddle, but after I've done the quaddle superficially, I have a little more deeper application of the needle, and I touch the periosteum to give a deeper stress on this area. You can do it. Okay.
Right.
Whatever you say.
Sure.
No good for the patient to listen what we talk here.
Well, I have to find out sometime. Thank you.
What is the special trouble, pain conditions? Very strong pain?
Yes, strong pain in the lower left jaw.
Yeah.
In that end.
Only to stress another idea, if you have patients with pain in the trigeminus, you have seen our measure points. They are situated, many of them, at the stomach meridian. And if it is a very hard pain condition, sometimes you have to treat the patient before surgery is done to help him to overcome the pain situation. So you can think that there are points in the ear lobe. In this part we can talk more about it tomorrow. You see it here, and I can control it if it's painful only by palpating again. Then with the fingernail, not so much. Other patients give very strong reaction if we go along this trigeminus area. And again, it's on the other side. It's more. What is now? Very interesting again. The pain area is left side. The ear reaction is much stronger on right side than on left side. Now we have again to think right with the brain. Is there such a trouble involved here? Please Ferdinand. She may be a right-hand person. For a right-hand person, it would be more typical to have the pain side left. But she has it on the right side. So there may be a brain trouble involved here. You have to control it by ear acupuncture.
Jim?
But it is no severe problem, you see. Not at all, but only for therapy it is important for us to think about. And please take off the shoes. A very simple stop. A very we can go on. No, only again palpating. You know that the stomach meridian goes along here, stomach 36, you know, and it comes down to the second tube. So we can have a little palpating here in this area if it hurts. It hurts a lot. It hurts a lot. Now I have the next area. Less. Yeah. Here's this area. No. So most pain is here or here.
The first place.
The first place. And the first place, think of it, the first place was between the big toe and the second toe. So we had not only to think again of stomach, but also of liver again. Same as that you said in the morning. Many of our pain patients, there are also problems with liver. And maybe for our homeopathic remedies, we can include also some
liver drainage?
Yes, for liver. For I've seen with many of our trigeminous patients that they have in many cases more pain in the situation of liver 2 and liver 3. And this says that there are many pain conditions involved also in the background of liver and gallbladder. No problem with liver and gallbladder in this organ. But we talk about functional circuits that are named as gallbladder liver. But, yeah, but it's not the organs. You could as well say number 3 or number 4 and would talk about this special circuit. It's nothing with your organs. Your liver is okay, your gallbladder is okay. They have to say to our patients. And if they hear to our information, they would think there's some trouble. There's no trouble in it. But only an energetic line which is connected. This gives a little signal here, and this signal is again a signal connected with this area. Is it?
Yes, plus she may have a devitalized tooth on tooth number, the second bicuspid on the left side, which would be stomach meridian also. Stomach.
And you know that this area, I had pressure here and here, it was painful on both sides. So again, it is the second tube in every case. So it's stomach as well as little liver. And liver, please, not liver as an organ, liver again is emotion. Liver again is in many cases all in acupuncture which is coming up and going down again. All pains, for example, trigeminous pain is like an attack. Sudden pain. Everything that comes up suddenly, pain in our joints, it wells up and goes. Everything that is
boiling
in such wave lines. We have to think of all this. May have to think a little more also in liver gallbladder direction. I will explain more tomorrow about it. Fine.
Thank
you. Only that we might, in acupuncture terms, think of these points too. You could treat these points.
Did you acupuncture treat those points?
I can treat it all.
Dr. Gleditsch to look at. So I guess we got some refreshments up in the room. Yeah, and then what, 8:30 come back tonight, and those of you that want to get in and find a partner, and you can do some neurotherapy. In this room here.
You make that coffee with sinus therapy.
Well, I was making it, and then the light went out, and I don't have a copy.
He hasn't, but he will.
Draw it on another piece of paper, but remember it, okay? Now, look at it again and remember it. Take it home up here. That's okay. All right.